All right, we may be short of Dr. Ezike. She may have gotten cut off.
Yes, Governor, you could go first, and we'll go back to Dr. Ezike.
I will. Also joining us today are not only Dr. Ezike, but Dr. Wayne Duffus, who's our acting state epidemiologist, who first joined one of our daily updates earlier this month to talk about our contact tracing initiative. I want to start today by giving you a simple way to think about what contact tracing really is. When someone tests positive for COVID-19, a contact tracer will interview them to learn about their recent contacts with family, friends, coworkers, commuters, classmates, and others. And if their exposure to any of those people in the last 48 hours was significant, those individuals would be notified and told only that they had been exposed to someone who has the virus. No names given. Contacts are then provided with education, information, and support to understand their risk and what they should do to separate themselves from those who are not exposed, and how to monitor themselves for illness and the possibility that they could spread the infection to others even if they themselves don't feel ill. Contacts are encouraged to stay home and to maintain social distance from others until 14 days after their last exposure in case they also become ill. Another option for them is simply to get tested. This straightforward process truly does reduce the number of new infections. And if done at scale, it can be a very effective weapon against COVID-19. With Illinois' daily availability of testing among the best in the nation now, we want to grow our voluntary contact tracing so that we can further control and reduce the rate of spread of COVID-19 and stop outbreaks in their tracks. Not only that, it's arguably our most sustainable tool. Knowing if you've been exposed to someone with COVID-19 gives everyday Illinoisans the ability to keep their families and coworkers and friends safe by helping them seek testing or self-isolate. And it helps us to build a better public health system that truly supports them if their exposure leads to actual infection. Contact tracing is a long-standing disease control measure, not new, and one that's been part of our COVID-19 response since our very beginning of addressing COVID-19. But as cases reached a massive scale of spread in Illinois and nationally, our existing public health management infrastructure simply could not keep pace with the tens of thousands of contacts resulting from the thousands of positive cases that we've discovered each week because of our growing testing capability. In the first month of our COVID response, existing contact tracers in Illinois were able to handle the caseload. But the chronic underfunding of local public health departments, together with the fast movement of this current deadly virus, put a severe burden on those local public health resources, limiting their ability to engage in tracing all of the possible cases. Now that testing has ramped up, only about 29% of our known cases are engaged in a tracing process. That's a number we want to push as high as possible to the industry standard of over 60%. But given the sheer scale of our population's widespread susceptibility to COVID-19, we can't get there with our existing infrastructure alone. So what we're building in Illinois is a tech-based approach that innovates and scales up existing systems. Illinois has 97 county and city health departments, and they are the foundational elements of the new Illinois Contact Tracing Collaborative, ensuring that this is a locally driven effort. We're scaling up within our local health departments and providing a statewide technology infrastructure to ensure a coordinated operation. That way, larger health departments can assist where smaller ones need help, and the state DPH can help coordinate multi-department collaborations. Technology is really an important part of our Illinois Contact Tracing Collaborative. In fact, it's perhaps the most important part. Fundamentally, there are three component parts of the technology that we're using. First, a disease reporting software that can take in reports from across the state and aggregate information from many sources. Second, a common management platform that operates as a unified way for public health officials in all parts of the state to investigate and trace contacts. And third, an app for use by the COVID positive patients and their contacts, allowing them to get services they need and giving local public health departments an easy way to connect to patients and their contacts with the latest information and healthcare guidance. Let's talk about the first piece of that, disease reporting software. Illinois already uses a disease reporting technology called the Illinois National Electronic Disease Surveillance System. But because of the scale of this COVID operation, we are putting in place a state-of-the-art project management and comprehension tool to collect and hold all raw information relating to contact tracing for COVID-19. Of course, our disease reporting system and contact management software has to be seamlessly connected. So for the second piece of our tech solution, we're building a forward-facing relationship management software for deployment throughout the state. This will allow all local health departments to work on one platform and allow IDPH to operate with an aggregated real-time dashboard showing where and how pervasive COVID-19 is in every part of Illinois. And the third piece of our tech solution is the app. Every COVID positive patient and their contacts will be encouraged to download an app that gives them easy access to the public resources to assist them while they're in isolation. The greatest strength of this new integrated infrastructure that we're assembling is that it will allow us to reach more people and to do so at a faster pace. At a high level, this model of contact tracing operates with the same scripts and the same steps all across the state, and still allows customized methodologies to account for the unique aspects of different neighborhoods and communities. With that community-specific element in mind, IDPH is working with Partners in Health, the world-renowned organization for building strong community-based health systems. This is the organization behind what's become known as the Massachusetts model for what's scaling up as a contact tracing operation and what the best looks like. As one of the group's earliest out-of-state collaborations, Illinois has teamed up with Partners in Health to learn from their global experience to determine what's worked, what doesn't, and what challenges they face as they design a community-based program in Massachusetts. Moving forward, Partners in Health will continue to advise IDPH on our program design and how best to tailor it to our communities. So what's next for Illinois? Most of our local health departments have provided their initial assessments regarding their ability to expand and deploy their contact tracing capabilities. And starting today and going forward, IDPH is gathering work plans and budgets from each department, allowing us to incorporate their local plans into our overall state plan and bring them online in the coming weeks. IDPH is immediately launching pilot initiatives with 2 local health departments, leveraging their existing operations and helping them expand their capacity. St. Clair County in the Metro East region and Lake County in the Northeast. Chosen for having significant needs in terms of case numbers in vulnerable populations, a capacity to grow their contact tracing, and great existing collaborations of public health personnel, medical students, and volunteers already on the ground. We're also in the process of incorporating other early leaders for this program, including the largest local health department, that's the one in Chicago, and we'll have more information on those additions in the coming days and weeks. In every region, the curriculum, software, and technology will be IDPH driven, and where needed, IDPH will support the funding of new hires at local health departments through federal CARES money and Disaster Relief Act dollars. As hires will be made locally, not through IDPH, compensation is determined by health departments in accordance with average rates in that region. That said, anyone who's interested in becoming a contact tracer can right now submit their information through IDPH, which will deliver names and resumes to the relevant local health departments. That interest form can be found on the IDPH website at dph.illinois.gov/COVID-19. Again, that's dph.illinois.gov/COVID-19. Thank you for listening, and I don't see that Dr. Ezike has joined us. Is Dr. Ezike on the line yet? If not, I'm going to turn it over to Dr. Duffus, who will talk more about the design of this program and the metrics that we're looking at going forward.
We'll go to Dr. Ezike first. She is on the line.
Oh, great. Thank you.
Sorry, Governor. Sorry for the technical difficulties. Good afternoon, everyone. I will start with numbers, and then we'll talk a little bit about some medical care needs. So since yesterday, over the last 24 hours, we are reporting 2,294 new individuals with COVID-19. We now have a total of 96,485 confirmed cases throughout the state of Illinois, and that encompasses 100 of our 102 counties. We also, unfortunately, are reporting over the last 24 hours 59 additional fatalities, which brings our total fatality number to 4,234. Over the last 24 hours, we resulted 21,297 specimens. And as of last night, regarding hospital statistics, we had 4,120 individuals in the hospitals with a COVID-19 diagnosis, and of those, roughly a quarter, or 1,096, were in the IC, were in the intensive care unit, and 636 of those in the intensive care unit were on ventilators. So as we continue to forge ahead in our life with COVID-19, there are things that we're going to start getting back to. And this includes, of course, taking care of our health, all parts of our health. While we're aggressively trying to prevent getting COVID and standing down if we do contract it, we also have other medical issues that we do need to attend to. I know there may be some fear about being exposed when we try to seek medical care for other issues, but we do need to prioritize our well care visits, whether it's our children's well care visits, whether it's going for a screening mammogram or other important screening or diagnostic tests. We have to remember that these health visits are important and they are essential, if you will, and they can't be put off indefinitely. And we know that COVID is not going anywhere anytime soon, so we need to make sure we prioritize these important medical procedures and events. So I urge you to talk to your healthcare provider and learn about what your provider's office is doing to protect the patients as they're coming into the facilities. They can let you know all the steps that they have taken to help you stay safe, to help keep their staff safe during your visit. Again, with the time that has elapsed since the beginning of our relationship with COVID to now, we now have a lot of information that has translated into important mitigation steps and additional steps to keep us safe as we try to take care of our health and visit our medical providers. If you have specific questions or concerns, call your healthcare provider. Learn what they're doing and get the medical care that you need. It's also important that you monitor yourself for potential new health threats. So we know all about coronavirus. We've been talking about that here every day, but let's not forget some of the other viruses that will continue to be with us as well. We'll be talking very soon about influenza and how we're going to protect ourselves against that. But let's not forget the HIV. The human immunodeficiency virus is another illness that can mirror COVID-19 symptoms. So we are reminded about the importance of continuing to routinely screen for HIV and to be vigilant about distinguishing COVID-19 from HIV, which may have similar symptoms. In an HIV Illinois Getting to Zero implementation council meeting that occurred last month, an infectious disease physician from the University of Chicago Medicine discussed that they are still routinely screening for HIV as they respond to COVID-19 in their emergency department. In fact, they diagnosed 2 individuals with acute HIV. When people are seroconverting from HIV negative to HIV positive, the symptoms they exhibit are often flu-like symptoms, which obviously mirrors what we're seeing in COVID-19 patients. So please don't ignore your symptoms and don't be prevented from getting the care that you need. We do need to take care of ourselves, our whole selves, including all of our physical health. We need to take care of our body, mind, and spirit. So let's do the things that we need, whether it's having a visit with our social worker or our psychologist, or a well child check for our child with the pediatric provider, or getting our screening and diagnostic studies. Let's take care of ourselves while being as safe as possible, while wearing masks when we're outside, while maintaining social distancing, while frequently washing our hands and cleaning frequently touched surfaces. We can do all these things together. Let's remain all in for Illinois. And now I'll briefly summarize these comments in Spanish. Buenas tardes. Empezaré con los números y hablaré un poco sobre otras atenciones médicas. Desde ayer estamos reportando 2,294 casos nuevos de personas con el COVID-19. Tenemos ahora 96,485 casos total confirmados aquí en Illinois. Desafortunadamente, esto incluye 59 personas adicionales con COVID-19 que han fallecido, un total de 4,234 muertos. 21,297 pruebas hechas fueron reportadas en las últimas 24 horas. Y desde anoche, 4,120 personas en Illinois fueron hospitalizadas con el COVID-19 y de ellos 1,096 pacientes están en la unidad de cuidados intensivos y 636 pacientes están en ventiladores. Como continuamos en el mundo con COVID-19, hay cosas todavía tenemos que hacer. Esto incluye cuidando nuestra salud. Sabemos que hay ansiedad y hasta miedo de contractar el virus cuando necesitamos atención médica, como visitas al pediatra o un examen de mamograma. Pero estas visitas de salud son muy importantes y no debemos posponerlas, continuar a posponer. Les recomiendo que hablen con su proveedor de salud y informarse de qué están haciendo para proteger a los pacientes. Si tiene preguntas o preocupaciones, llame a su proveedor de salud para que obtenga la información que necesitan para obtener su atención médica. Es importante vigilar su salud para protegerse de cualquier nuevos problemas que tiene. Por ejemplo, alguien con VIH puede tener síntomas parecidos del COVID-19. Tenemos que recordar la importancia de seguir examinando para VIH y seguir vigilante de distinguir el COVID-19 a otras enfermedades que pueden tener síntomas muy similares. En la reunión del mes pasado, HIV Illinois Getting to Zero, un especialista en enfermedades infecciosas de la Universidad Médica de Chicago, mencionó que todavía siguen examinando rutinamente para el VIH mientras responden al COVID-19 en su departamento de emergencia. De hecho, diagnosticaron a 2 personas con VIH. Cuando las personas con VIH negativo pasan a VIH positivo, los síntomas que muestran frecuentemente son como la gripe y pueden tener síntomas parecidos a COVID-19. No ignore sus síntomas o deje que su ansiedad lo prevenga de recibir el cuidado médico que necesita. Necesitamos continuar manteniendo nuestra salud general, cuerpo, mente y espíritu. Nos tenemos que cuidar contra COVID-19 y todas las enfermedades que hay en este mundo. Hay que seguir luchando, pero lo tenemos que hacer juntos. Muchísimas gracias. And with that, I will turn it back over to you, Governor Pritzker, to introduce Wayne Duffus.
I will. Just briefly, you've seen Dr. Duffus at our daily briefing at least once before. He's leading our contact tracing effort. It comes to us from the CDC and other international experiences with contact tracing. And so I'm proud to turn it over to Dr. Duffus for more on our contact tracing initiative. Doctor.
Thank you, Governor. So as Governor Pritzker has stated, contact tracing is a long-standing concept and one that's been part of COVID-19 response since the beginning. But as cases increased rapidly in Illinois and nationally, many of our local health departments simply could not keep pace. Because of this, I was given the charge to work along with my colleagues, especially those at our local health department, to establish a robust contact tracing program which will meet our needs. At the state level, we've organized ourselves into a contact tracing work group and sub-work groups, and we're in the process of reaching out to the local health departments to join these subgroups. These subgroups will meet daily to provide direction and coordination, determine operational needs, example, needs for laboratory resources, staffing, and finalize the technological aspects of our plan and react to surveillance data in a timely manner. However, it is our local health department, with collaboration from community partners, that will serve the pivotal role because of their expertise conducting this type of work for a variety of communicable diseases, such as measles, TB, and sexually transmitted diseases, and also because of their strong community relationships and knowledge of the needs and available resources in their communities. In designing a COVID-19 contact tracing program, there's certain key considerations. Since COVID-19 can be spread before symptoms occur or when no symptoms are present, case investigation and contact activities must be swift and efficient. What does this mean? This means that an increased availability of tests and a timely return of positive results to the patient and reporting to the local health departments for contact tracing follow-up is important. We will prioritize remote communications for the purposes of finding out how cases may have been exposed to the virus and finding out who, in turn, they may have exposed. In-person communication will be done only after remote options have been exhausted. The first contact will be through a technological platform, such as text message or an email, which we hope most individuals will respond to. And if this is ineffective, then at least 3 phone calls will be made, and only as a last resort will there be in-person visit. We will increase testing capacity, which will allow us to test everyone who has been identified as exposed to the virus and to identify early people who have been infected to help stop transmission. For contact tracing to be successful, we must and will have broad engagement with the residents of Illinois so you can understand and accept what we're asking of you during this public health crisis. As such, we recognize that significant social support may be necessary to allow Illinois residents with COVID-19 and exposed to someone with COVID-19 to safely self-isolate and close contacts to safely self-quarantine. We've included resource coordinators into our program design, and these coordinators will work with cases and contacts to help with needs that can help during the time they're being asked to stay away from others, such as access to alternate housing, food banks, medical monitoring, and mental health services. Due to the magnitude of the pandemic, local health departments will likely need to enhance their contact tracing workforce, recruit staff, and train individuals from varied backgrounds. The free online curriculum offered by the Association of State and Territorial Health Officials, ASTHO.org, will be the acceptable minimum training. However, individual local health departments may have additional training requirements, and we are aware that various accredited colleges and universities are offering courses. Taking one of these courses is not a job guarantee, but may be suitable for those who desire more advanced skills. I would like you to know that we recently sent out a survey to all 97 local health departments to learn about their needs to conduct contact tracing, and I've learned the following from 55 that have responded so far. Here are the questions. How many staff currently work on contact tracing? The average that was told to us is 6.3, with a range of 1 to 40, which means that local health departments have been working on contact tracing from the beginning. What about their workload? Number of contacts per employee per week. The number returned to us was an average of 73, with a range of 1 to 525 as the workload. Number of contact tracers needed to effectively respond. What came back to us was 70, and the range was from 1 more contact tracer to 900. Ratio of supervisor to contact tracer, the average is 1 to 8, with a range of 1 to 9. Of the 55 local health departments that have responded, 27% report having a community-based organization that they work with currently or would like to work with. Of the 55 local health departments that have responded, 42 or 76.3% have language interpretation services. And finally, of the 54 that responded, 45 or 83% currently have a staff that can link cases to resources. So these are just an example of some of the questions that we've asked. There are many more that once we get a response from all 97, we'll report out to you. But I want to just to reinforce that the local health departments have been working in contact tracing from the beginning, that they do have resources that's been geared towards contact tracing, but this has been overextended because of the volume of cases that we're getting, that it's hard for them to keep up, not just in Illinois, but nationwide, as we've been hearing on the news. And this program is dedicated to scaling up rapidly. IDPH has communicated to the local health departments to start today to immediately use this information to draft their work plans and budget requests. So how will we know the contact tracing program is achieving our goal of eliminating ongoing COVID-19 infection? Well, we will know because we're including metrics into the collection and reporting of all interaction between cases, contacts, and the local health department contact tracing staff. The new technological platform, which includes emails and text messaging, will make these easy to collect and report. Examples of potential metrics which will be routinely reviewed will include the following. So for case interviewing, we'll ask about time to interview from symptom onset and diagnosis. We want to know the proportion interviewed. We want to know the median number of contacts elicited, and we want to know the proportion with no contacts elicited. For contact notification, we want to know the proportion of contacts notified. We want to know the time from first potential exposure to contact notification. For contact follow-up, we're going to ask the daily proportion of contacts whose status is evaluated. We will ask the proportion of contacts with symptoms evaluated within 24 hours of onset of symptoms. And for contact tracing efficacy, we want to know the percent of all new COVID-19 cases that were monitored by the contact tracing program. So from that list, you see at all aspects of the program, we'll be assessing performance and making modifications as the data comes out so that we can achieve our goals. We have in fact already engaged modelers from Northwestern and the University of Chicago, and we will use the developed models to tell us about the success of our contact tracing program. So altogether, we're building on a program that is already underway by including efficiencies, promoting local ownership, and addressing the needs of our residents. For local health departments, please look forward to more future engagements as we plan and build the contact tracing program. Thank you for your time and attention. I'll turn back to our governor.
Thank you very much, Dr. Duffus. Thanks for all the work that you're doing to help us spin up this really tremendous program. Before I take questions, I want to address the recent addition to the toolbox of enforcement mechanisms available to local law enforcement and state's attorneys, because there seems to be some confusion out there about what this is and what this isn't. So I want to lay out the facts for everyone very clearly. Right now, local law enforcement and state's attorneys are regulating and enforcing the public health restrictions, helping to bring down our infection rate and keep us safe. But they've had limited latitude to do so when local businesses are breaching public health protocols. As I've said since the beginning, it's my strong preference and that of the Illinois State Police and other law enforcement that communication and education should be our first tools to encourage compliance. For the vast majority of residents and businesses, that's been very effective. For business owners who have decided to put people at risk by not following our gradual reopening plan, there are a limited set of warnings and then penalties that can be invoked. Let's use a restaurant and bar as an example. Before today, for a restaurant and bar that refuses to comply after communication from law enforcement or even after a cease and desist letter, the state can revoke the business's liquor license or impose a closure order by IDPH. Both are expensive measures for a business to come back from, and they're not preferred by anyone, least of all me. Under the current Illinois Department of Public Health Act, when a business violates an IDPH rule and puts public health at risk, the business has committed a Class A misdemeanor. That's the existing law today. In fact, last week and last year. Under that existing law, law enforcement can issue a citation to the business. An emergency rule requiring businesses to follow the existing stay-at-home order has now been put in place. This additional enforcement tool, the citation, causes less harm to a business than a total shutdown or a loss of a license, but gives local governments and law enforcement the ability to do their job. Many other states have enforcement tools like this, but not Illinois, until now. This rule can only impact a business, not individuals, and is a response to only a select type of violation. This cannot be used, for example, to regulate individual conduct, like not wearing a face covering. And as with any misdemeanor offense, local officers can use their discretion, and state's attorneys can apply the facts and the law fairly on a case-by-case basis like they do every day. For those businesses operating in the best interests of the health of their communities, nothing has changed. You're part of the 99% of Illinois businesses that are following our gradual reopening plan, a plan that, based on the data, is likely to move all of Illinois into phase 3 and reopen thousands of businesses beginning only 11 days from now. Nothing's changed from the approach that we asked ISP and all local law enforcement to take from the beginning when a business is ignoring the phased approach to reopening. Our first and best option for enforcement is what we've all been doing, relying on Illinoisans to be good neighbors and good citizens, working together to keep each other safe. The strength and compassion of our communities have gotten us this far, and I have every confidence in the people of Illinois that they will carry us through together. Thank you, and now I'd be happy to take any questions from members of the media.
Pool reporters, we're going to keep it tight today, so everyone will get about 10 minutes each to ask questions so that we can get to most people from across the state. Elizabeth, we'll start with you.
Thank you, Governor. Hope you and Dr. Ezike and Mr. Duffus are all well. What encouraged you to make this emergency rule? What was the straw that kind of broke the camel's back?
Really, it was just to give another tool to law enforcement. It wasn't that there was a straw that broke a camel's back. It was that, you know, we don't want to have to pull licenses from people. We don't want to have to shut a business down. What we really want is for people to comply, and we want to give them, you know, this type of citation as an alternative.
Okay, how far are you willing? This is from Greg Bishop, CenterSquare.com. We did receive a few questions about this, so thank you for speaking about this. How far are you willing to go to enforce your orders? And also, will you direct state police to enforce this in communities that have said they're either will not or cannot enforce your executive order?
Well, this is within the existing law, the Illinois Department of Public Health Act. So, that's the extent to which we're seeking to enforce the law. You've seen that I'm very interested in reopening businesses across the state in a safe and healthy fashion. And we're on our way to being able to do that. But there are people who are endangering people in their own communities. And we wanted to be able to give, again, local officials, local law enforcement, the ability to do what they need to do.
Craig Wall with ABC7 would like to know if anyone received misdemeanor charges over the weekend, and can you respond to criticism that this is an overreach of your authority?
Well, again, this is a citation. You've heard of a traffic citation. This is another kind of citation. I'm not aware of anybody having received one over the weekend. And what was the last part of that question from Craig?
Respond to criticism that this is an overreach of your authority.
Well, it's in the law today. It's in the Illinois Department of Public Health Act. So there's not an overreach here. And in fact, it gives us a lighter enforcement mechanism than the ones that already exist.
Thank you. Changing directions a little bit here. This is a few questions about businesses reopening. Samantha Chapman with ABC7. Dozens of Ford workers have reached out, furious that the company is reopening, worried that they may contract COVID-19. Is this type of work appropriate during this phase of the stay-at-home order? What's your message to the concerned Ford workers?
Well, actually, vehicle manufacturers are covered under the Department of Homeland Security's list of essential businesses. So they really did have the ability to remain open all of this time. I'm hopeful that people can get back to work at the Ford plant in Illinois and not to mention the Chrysler Fiat plant in Belvidere. And so, I want to see manufacturers and other businesses open up as we get to phase 3 about 11 days from now.
My colleague at Fox 32, Dane Placco, has a question about harness racing. Many owners believe that they can do it safely through social distancing, no crowds at the track. Are you looking at possibly allowing Hawthorne and Arlington to reopen for online gambling, but no crowds?
Yeah, we're looking at all the alternatives here. You've heard that Major League Sports, for example, I think rightly so, have said probably can't get crowds together in a stadium, but they can run their games and televised and so on. And that's true with horse racing potentially as well. So we're definitely having conversations. The racing board, our office, as well as the leaders in the horse racing industry, including harness racing.
Okay, thank you. This question comes from Jim Williams, CBS2. Would you react to your reaction to businesses adding surcharges to bills, citing added expenses due to COVID-19? What's your reaction to that?
Well, I don't know how to react to that. I mean, I know that businesses are suffering and they're trying to, figure out how they can open, and operate profitably with a downsized number of people potentially in their business. So, I don't want to encourage that. People are hurting. People who are, shopping, especially for essential items, certainly should not be charged a surcharge for that. But I'm unaware of what the businesses are that are attempting to do that. And I would just suggest that they be careful about it.
This question comes from Megan Hickey with CBS2. It refers to unemployment issues. Can you provide more specifics on Friday's POA system data breach? How long was the sensitive information out there? How many people's information was exposed? And what's been done to fix this issue?
Sure. Well, first of all, we are doing and have been doing a full investigation of the matter. It's important that we identify all of those who were affected by that breach. This is, as you know, has happened in large corporations and other aspects of other governments around the United States. And, we don't like it happening here. Deloitte, which built that system, and obviously the glitch that was in there is something that was a result of the work that was done to build it. But they are offering credit reporting for all of those who are affected by it to make sure that they can monitor their credit in case there's, any problem that they may undergo. But we are still investigating the number of people who were affected by it, and we want to make sure that we get the system completely kind of hack-proof and safe.
Elizabeth, this will be your last one.
Okay, this is from Marianne Ahern. There are questions that have surfaced about several companies, Path Group and Q Health, as well as a third business that are providing COVID testing in Illinois and elsewhere. All are owned by the Pritzker Group. Are you personally profiting in any way?
Well, as you know, Marianne, 3 years ago when I decided to run for governor, I put all assets in a blind trust form, and they continue to be in that form. And so I'm not involved. I really don't even know the engagement of those businesses in any thing that has to do with this. And, I'm really 3 years from having had any knowledge about any of those.
Kelly from Block Club, you're up.
Hi, Governor. Our first question from Block Club. Will you shut down General Iron in Chicago after this morning's explosion? Why is it being considered an essential business?
Yeah, so EPA is looking into it. I know the city of Chicago is, has jurisdiction as well. So, we're actually, as you can imagine, paying very close attention and want to make sure that people are kept safe. I'm unaware of what the latest is on the matter, but it's certainly something of great concern to me.
Okay. But why is it being considered an essential business that's being allowed to stay open right now?
I can't describe, let me just say that the Department of Homeland Security's list of essential businesses is really what we use as the baseline for our list of essential businesses. And so I would have to refer you to the Department of Homeland Security for the reasoning behind that particular business. But, again, we were trying to follow national emergency protocols here, which is what we're in. And that's, the essential business list that we used as our base.
All right. Church leaders in Chicago continue to host services. Is there anything you're looking to do to increase enforcement and to stop that from happening in Chicago and elsewhere?
Well, again, I've been extraordinarily reluctant to, we're talking about whether it's the city of Chicago or anywhere in this state, to interfere with a service that's ongoing. What we have tried to do is communicate and educate to the faith leaders and the parishioners. Look, the job here, the goal here is to keep people safe. I want people also to be able to worship. There are many ways in which to do that during this time, and I know it's very difficult, but people are allowed to, worship in groups and or less. Lots of people have discovered that they can Zoom and worship together, that there's video, a connection with their pastor and so on. And I want to encourage that. And I know how difficult this is. I mean, so many people care deeply about the community that is their church or their mosque or their synagogue. I do too. And so, we want to get back to it as soon as we can, but we have to keep each other safe. And I hope that faith leaders will heed the public health concerns and follow the reopening plan.
Okay. And when can gig workers expect to start seeing pandemic and employment benefits direct deposited into their accounts or on their key bank cards?
Well, as I understand it, first of all, many, many people have already signed up and have their claims approved. As to when they will get it, I know that I believe that just as in the regular unemployment system, that people will be able to get the 1 week waived, and that they'll be able to get that over the next 2 weeks. But I want to defer to my IDES personnel to get the correct answer for you. So I'll ask Jordan to respond to whoever, if that was your question, I'm not sure, but we'll make sure we get you the right answer about the date, the first date on which people will start to see deposits.
All right. And then the state, this is also from Black Club. The state plans to reopen non-emergency daycares in phase 4, but many parents are returning to work next month during phase 3. What would you say to those who need childcare, or are you considering moving non-emergency daycares to phase 3?
So if you go on our website at coronavirus.illinois.gov, you'll find emergency daycare that's been set up. It's actually been in existence already, more than 2,500 existing daycare facilities. And then in addition to that, we are expanding daycare, still looking for more emergency daycare providers, but looking for ways that we can increase coverage for people. And we have a task force that's specifically dedicated to that, of experts in the childcare field. So, but please go to the coronavirus.illinois.gov website and look for daycare near you that's part of our emergency daycare, emergency childcare.
All right. As a follow-up to that, so what ways is the state looking to increase coverage for people? Just because we've heard of daycares that have waiting lists of 50 or more people.
Yeah. This is the way that we're doing it, is with emergency licensing and with higher reimbursement rates, because we know that it's more difficult to run a smaller daycare than it is a larger one. We want childcare to be more available, and we want people to be able to afford to run a childcare center and do reasonably well doing that. And most of all, we want them to provide that care. So again, we've got many more licenses that can be granted, and I hope many more people will apply to provide that kind of childcare.
All right. And new data shows fewer people are adhering to the stay-at-home order. Do you expect another surge in cases this summer or fall because of that?
Well, I'm concerned about it. I don't know if I expect it exactly, but I am deeply concerned about it. It's the reason why we're following this very gradual plan. But it makes sure that we have the healthcare capacity to deal with any kind of surges. But yeah, if people don't follow the plan, or if people don't wear face coverings when they're out in public as directed, more people are going to get coronavirus, COVID-19, and I'm deeply. Honestly, it's what I wake up thinking about, go to bed thinking about. How do we keep people safe? As I know that it's, we have beautiful days, that are coming throughout the summer, and people will want to be outside wherever they are in the state. They'll want to be together, gathering, and we just want them to do everything they can to keep themselves safe. So we'll keep monitoring. We hope people will follow the rules, and I think we'll be able to make it through to the fall. And then I must say that I'm concerned about all of the warnings that have been given by epidemiologists about the potential for a surge in the fall, because if people don't learn the lessons over the summer that we've learned over the last couple of months, and then we hit a fall surge, we're going to be in big trouble.
Kelly, you have one more.
All right. This is from Greg Hines from Cranes. Governor, could you please explain why, without any public notice or discussion, you over the weekend filed a new regulation establishing a misdemeanor offense for businesses which reopened despite your shutdown order? Even if this is needed, why do it this way?
Well, I think you understand why we put it in place. It was a tool, as I described, for law enforcement. We were working on it during the week. We issued it on Friday, and it's something that doesn't establish a new misdemeanor. The misdemeanor is already in the law, so it was simply a change of rules.
Okay, we'll go to online questions. This is from Tina at the Sun-Times. Governor, do you think there should be legislation passed this week during session to further clarify your powers under the stay-at-home order extension, or also your reopening plan?
I think that we're on a good path. We've got a Restore Illinois plan that puts us on a good path to reopen. And so I think existing legislation has been good enough. So I'm not seeking anything from the legislature. And to be honest with you, there's so little time that the legislature is likely to be in session here that I think it's going to have to be focused on the very basics like a budget.
This is from Sam at NPR Illinois. Governor, are you worried about you or your family's safety after anti-Semitic hate speech was used during protests over the weekend?
yes, I have to admit that I am worried about my family's safety. You saw some of the signs, you saw the vehemence that people who were carrying those signs with swastikas and pictures of Adolf Hitler, references to me and my family. Yeah, I'm concerned. But I also want you to know that I am undeterred from the path that we're on. I think we're doing the right thing. Again, vast majority of people in Illinois are doing the right thing. And indeed, you are seeing it in the numbers. Just look at what is happening. And it's happening because everybody banded together following the rules to do, to do what was necessary to keep each other safe. I hear that there are people that are planning to show up in Springfield in the legislature not wearing a mask. Think about what that says, right? Because a mask isn't designed to protect you, it's designed to protect the people you're with. So the callous disregard for people's health that those legislators demonstrate is, and those were the same legislators that showed up at those rallies with those swastikas and those pictures of Hitler, and they were perfectly willing to stand up and speak in front of that crowd. That was okay with them. I mean, it's not okay with me, and they are in fact putting people in danger. One of those speakers, the GOP U.S. Senate candidate, actually called out Senator Dick Durbin's home address and told people they should go to his house and surround it. That's dangerous.
Sarah from the Daily Law Bulletin. On Friday, at a hearing over Representative Darren Bailey's lawsuit, the Clay County Court deputies were not enforcing social distancing or mask rules. Will ISP get involved if local officials do not enforce your new rule, or if the social distancing or mask rules as well?
No, that's not the role of ISP. So, we know that states' attorneys and law enforcement around the state, vast majority of them, are doing the right thing and enforcing in the right way. And Clay County, I mean, it speaks for itself that, the decision that was made in that courtroom a couple of weeks ago and, continuing, I would say, disregard for the law in Illinois. I think it speaks for itself.
Dave Dahl, WTAX. Governor, since the beginning of this, you have said, quote, lives over livelihoods. Why are they mutually exclusive?
They're not. What I have been focused on, Dave, is making sure that the balance weighs in favor of keeping people safe. That, the job here is to make sure that while we're reopening the economy, remember at the beginning of this thing, we didn't know how fast this was going to affect the population. And you've seen it, it's moved pretty fast. We didn't know how fast it was going to take people from being well to being on a ventilator and dying. And it moves reasonably fast, I hate to say. We've learned a lot in this process, but what I know is that every decision that I've had to make has been a difficult one, in part because I know there are things that we've had to do following CDC guidance, I might add, that has affected people's livelihoods, and that disturbs me. And I want very badly for us to move ahead and let people get back to their livelihood. But most of all, I want them to stay alive while we do it.
Bobby at Heart of Illinois ABC in Peoria. What are your thoughts on the 11 North Central counties Heart of Illinois reopening plan? They say their plan includes more metrics than yours, but moves a little faster. They say IDPH approved of the methodology. Why not allow them to proceed?
Well, again, we've talked about the many, many plans that have been submitted, and I've read most of them, if not all. And some of them are well crafted. There's no doubt about it. But ultimately, a decision had to be made about how to put a plan together for the entire state of Illinois and regionalize it. And that's what we did. And again, I know there are people who might like this to be done on a different grouping of counties, or they might like to see certain cities open and not the rest of their counties. I'm sure there are lots of ways to do this. But what we did was driven by, again, science and epidemiologists, but also with a drive by me for the, a real desire to open businesses again, with safety precautions at every step of the way.
Jerry Nowicki, Capital News, Illinois. Republicans want the graduated tax off the ballot. Is there any chance you think their resolution gets a vote in the upcoming session? Are there any revised estimates to what anticipated revenues from a graduated tax would be for next fiscal year?
I believe that the estimate for the revenue from the graduated income tax is over $1 billion just for next year, because it's a truncated year, as you know, and also a very unusual fiscal year in the history of the state. But as to the likelihood of a vote being taken, or a decision being made like that, I can't speak to it. I can only say I think it's the GOP wants to keep people from voting on this, to keep people away from the ballot box. Says something about their lack of confidence in their position.
Shia Politico has a question about the new IDPH enforcement rule. Do you think that means the state's getting tougher on enforcement, giving so many local jurisdictions and others are thumbing their nose at the EO? And how do you recommend social distancing and mask wearing during the legislative session?
I think I answered the first part of that question earlier, and so I'll just take the mask wearing. I mean, I think, as I understand it, the House and the Senate both have required or asked all of their members to wear face coverings. It makes eminent sense to me. I put a rule in place that requires people in public or where they can't socially distance in groups of 10 or more to wear a mask. So I hope they will. And I don't know whether people will follow it or not. Most of the legislators that I talk to understand that it is necessary. It is something that is, again, it's about keeping the other people that you're with safe.
Chris Carter, WAND News. The Illinois Restaurant Association expects 20% of restaurants not to reopen following the shutdown. What is being done to help keep them afloat to avoid such a drastic closure?
Yeah. Well, I think you've seen what the federal efforts have been. I would describe them as not good enough. The PPP still has not reached many small businesses, many people who couldn't hire lawyers or accountants to get that PPP money. And so I think we here in Illinois, as we get support from the federal government for state and local governments, and I'm somewhat optimistic that we will, that we should use some of that to support these restaurants, particularly in bars, people that have had to stay closed longer than others. But it's very important to me that we lift up these small businesses. It's it's something I believe deeply in. It's something that I, was engaged in before I became governor, helping small businesses grow. And I know that the lifeblood of our future economic growth is in those small businesses. So we're going to work on that in Springfield. I've talked to legislators about it. I've also talked to our federal officials about trying to get specific provisions in support laws that are being passed for restaurants in particular.
Dave McKinney at WBEZ will be our last question for today. An agenda item for lawmakers this week is potential election legislation. What specific things would you like the General Assembly to address in an elections bill that might get sent your way?
Well, the most important thing, and I've talked about it some number of times now, is we've got to give people the ability to vote by mail, make it much easier for people, because at this point, I know that fewer people going to the ballot box in November is better for all of us in terms of keeping people healthy and safe. And so I'm looking forward to I've called upon the legislature, and I know that many, many members agree with this, to pass legislation that'll make it easier for people to vote by mail. So that's the primary thing that I think we ought to be focused on when we get to Springfield. But no doubt there are some smaller important provisions, in order to keep our elections safe, and I mean safe in a different way, from hacking, from interference, and so on. So I'm looking forward to seeing those ideas in legislation next week or this week, later this week.
All right, that's all the time we have for. Thank you very much. We'll see you
Thanks
all.
for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.